Okay, I'm joined by two people who can help answer your questions on what we should be doing now and how to look after ourselves in the coming days and weeks. My guests are Sara Moseley from the charity Mind Cymru and Dr. Giri Shankar from Public Health Wales. Thank you both for coming in. Dr. Shankar, if I can start with you, help us understand the advice that's coming out of government at the moment. Social distancing, self-isolation for the vulnerable and the elderly. Those are the right measures.
Of course they are. They may look quite unprecedented, but they are essential at this point in time where we find ourselves in the pandemic. It is important once again, but to remind our viewers that for a vast majority of our population who contract coronavirus, they will be mild illness and they'll recover really well after a period of 7 to 10 days. So it is this minority of 15 to 20% of individuals for whom it will be a much more severe infection resulting complications. It is to protect that group that we all have to play our part and follow the new advice.
Do you think the advice could be more specific? I mean, it's advising people to perhaps stay away from pubs and clubs. Do you think it should be banned, absolutely clear what we should and shouldn't be doing?
It's important to recognize that these are unprecedented actions that we are asking our communities to take. But for a vast majority of our communities, they all understand that they have to do this in the hope of protecting their loved ones, their family, friends, etc. As a result of that, asking them to comply with that in a non-imposing way is the right thing to do.
Okay.
Most people will be sensible, they will follow the advice.
Okay, well, let's get a question now from one of our viewers. This is Emma from Llanelli. Let's see what she has to say.
I'd like to ask why everyone who suspects they may have the coronavirus isn't being tested in Wales. I understand that this would put another strain on the NHS, but surely it would mean that a lot more people that have got the virus would be self-isolating at home.
This is a question we're hearing a lot, Doctor. So what's the answer to that? Why no testing? I mean, I can completely understand the request for that. But we have to realize that the significant move from a containment phase to a delay phase was on the basis that there is widespread transmission, there's widespread infection in the community. So testing each and every one of them to confirm that that is the case actually doesn't give us any additional information. We are working on the basis that there is widespread infection in the community. Therefore, it makes it prudent to test the people who are most at risk and who are hospitalized, who are having complications, and people who are actually caring for them. However, there are discussions going on now at the moment that within a short period of time, there will be considerations given to expanding the testing, but we don't have those details as yet, but they will be confirmed shortly.
I've got it. Hope that's an answer for you, Emma, at home. Let's bring Sara in here. People are reeling from this. It's difficult to sort of keep pace. I mean, last week seems like a year ago. It's very worrying as well, and people can start to get a bit overwhelmed by all this, can't they?
Yes, definitely. And it would be surprising if people weren't worried and anxious. And I think, you know, we're going through a big change that's happened really quickly. So we are having to adjust our way of thinking and our way of living. And I think as we do that, there are a few things that we can do to look after ourselves psychologically. And, you know, they range really from perhaps limiting the amount of time that we're talking about this, we're looking at this, we're listening to the news all the time, feeding, you know, all those anxieties that we've got.
Hopefully we can dispel some myths as well.
Yes, and dispel myths, because that's another really important thing to do, is to be really clear that you're going to reliable sources of information, authoritative sources of information. And as more and more of us perhaps are self-isolating, I think there's an opportunity for us to maybe think about how we're going to reorganise our lives in order to be able to do that in as positive a way as possible.
We've got to stay positive. That's the only thing we can do right now. Let's get another question from a viewer. This is Kim from Wrexham.
More guidance and clarification is needed for people like myself who are immunosuppressed due to treatment for autoimmune conditions.
More advice for people who feel very vulnerable like that and have underlying health conditions.
So the detailed advice around people who have got underlying medical conditions, including immunosuppression, are available now on the websites. So they can be accessed through the Public Health Wales's website, linked to the Public Health England website. However, it is important for all those individuals who have such conditions to be very clear that their usual care provider, whether it's their family doctor or a specialist that they are under the care of, that they follow their advice in terms of their medication, their habits, the frequency in which they need to turn up for appointments, checkups. But in addition to that, it is important for those individuals to actually stay away from individuals who may be showing symptoms of coronavirus. As far as possible, isolate themselves in their own homes and follow the public health advice.
Let's try and end on a bit of a positive note. There is help and support out there. The group you represent are here to listen and help people if they are feeling very isolated with this.
Yeah, I think that kind of contact is really important. So if you can't meet people face to face, for instance, there are groups online. So Mind has got a group called Ellie Friends, where any time of the day and night you can go online and talk to somebody else who's in the same boat as you. I think it's quite important, if you know that you're going to go into self-isolation, put a plan together. Who are you going to be talking to? How are you going to be contacting people? What are you going to be doing with maybe other people who are in the same boat as you are? And I think if you can find a plan for yourself that includes doing things that are meaningful and actually, you know, doing things that you might have been putting off for ages, and then you can do them while you're self-isolating. Okay. I think it's that planning and feeling that you've got a bit of control over the situation.
Be proactive then.
Yeah, can be really helpful.
Sara Moseley and Dr. Shankar, thank you very much indeed.